Thank you very much. I'm really pleased to be able to share a little bit about this book with you. So I want to just take the time to thank you for making the time in what I know are undoubtedly very busy days to spend a little bit of time with me and learn about this book. So I do thank you for the effort. Molly, next slide, if you would. I thought maybe we could begin by, I'll introduce myself a little bit to you and share some of my background. I won't belabor this, but I do think it's helpful when you're making difficult decisions about books or trying to figure out the perspective of the author or this kind of thing, because you know that all of that influences the type of writing and content and activities and whatnot that are included. So I am a baccalaureate grad. I went to the Penn State University, and in '86 I graduated with my master's degree in nursing administration from the University of Pennsylvania. In '98 I graduated with an education doctorate in higher ed leadership from Widener University that's here in Chester, Pennsylvania. And in 2009 I went to a postmaster's certificate program where I became an adult nurse practitioner. Next slide, please. I want to just point out my trajectory has been a little bit different than some and might even be more similar to some of you. And that is that although my master's degree was in nursing administration, when I left that degree program in '86, I was working in admin. And as I completed my doctorate, I began to think about university level teaching positions. I had been teaching in a diploma program. I was the coordinator for the medical surgical education areas of this program while I also worked per diem. And I decided that I had an opportunity to begin teaching at the university level, and I was asked to take responsibility for the clinical nurse specialist track. I did not know much about this role, but it was intriguing to me because at that time we were describing this role as basically a compilation of lots of different sub-roles, right? Researcher, evaluator, administrator, clinical expert, all of these kinds of things. And so back in those days, I was able to take the clinical nurse specialist examination as long as I satisfied certain coursework, you know, pharmacology, physical assessment, etc., and had an MSN. So the reason I point this out is because most of my professional background has been as a clinical nurse specialist and as a nurse practitioner and as an administrator in one form or the other. And that in addition to my current role and past roles as an educator. So I want to explain this to you because this sort of combination of roles is why I have made the decision that moving in the direction of broadening the book and these resources to all different sorts of nurses in advanced roles is informed by my background and my own educational experiences. And I hope that that perspective is a little bit helpful to you. I am credentialed as a ClinSpec and, as I said, an adult nurse practitioner as well. Okay, now a couple of points here. How did I end up at this point where we now have this Indirect Care Handbook? One thing I told you is that I was responsible for the Clinical Nurse Specialist Education Program, and I became very involved as well in the National Association of Clinical Nurse Specialists, and that role had really been my home base for, you know, what is now almost 20 years. And what I was finding is perhaps what some of you find, whether you're teaching nurse practitioner students or nurses who are interested in, you know, administration or informatics or whatever it is that people are doing. And that was that I was constantly having to pull from the literature a variety of resources because I could not find a book that actually spoke to the real world practice challenges that advanced practice nurses were having to confront. At this point in time, that was around a book that I originally started with, the Clinical Nurse Specialist Handbook. And I was finding that I was doing a lot of work around creating modules of learning that were not backed up by a single text. And that particular book, The Clinical Nurse Specialist, was very well received within the ClinSpec world. It was an AJN Book of the Year award winner for 2007, and it was used in many of our ClinSpec programs. And I have come to realize that that need is really broader than just with clinical nurse specialists. Next slide, fine, Molly. Thank you. So this Indirect Care Handbook actually expands on or broadens the discussion of the Clinical Nurse Specialist Handbook. And what the goal is of this book, and I think that the goal is met, at least this is what I'm told through feedback of peer reviewers and also of my colleagues who I've asked to read and critique the book as I was developing it. And that is that we want to have breadth and depth across key content areas that we recognize are critically important to nurses who are in advanced roles. And you'll notice that I'm not saying advanced practice roles, because although APRNs, specifically nurse practitioners, clinical nurse specialists, midwives, and nurse anesthetists, although they are the crux of our advanced practice domain, there are nurses in advanced roles who need this content as well. And we'll talk a little bit more about this as we continue to move through the book. One of the problems that I see is as we commonly refer to it anymore, is this idea of a wicked problem. And what I mean by this idea of a wicked problem is that we have so much to teach our students. There's so much to learn. There's so much that we are responsible for ensuring that our students learn about, sometimes driven by practice demands and sometimes, of course, by credentialing demands, that we scramble a lot of times to try to fit, as we oftentimes discuss it in our faculty meetings. We really scramble to try to fit all of this learning into the package that we are able to provide to our students. And our indirect care responsibilities are really important. And yet many times these are the ones that we don't have the sufficient resources, including time, including faculty expertise, to cover within our curricula. So these kind of indirect care topics like performance appraisal, quality improvement, outcomes measurement and management, safety, self-care, risk and harm. We oftentimes don't get to these topics the way we'd like. And if we want to get to them, we have to spend a lot of time pulling together resources in ways that are very time consuming for faculty and not particularly helpful oftentimes to students who don't have a sort of guiding reference to sort of walk them through many of these indirect care content topics and challenges. We also have intraprofessional and interprofessional impediments to collaboration. And let me just share with you what I mean by this. We talk a lot about interprofessional education right now. We know that we're moving in a direction in healthcare where collaboration among the healthcare team members is recognized as critically important to improving outcomes. We know this. We know that working with our colleagues is really important. But I would suggest to you and to others that we also have an intraprofessional problem that is this persistent, pervasive issue. And that is that a nurse practitioner may not know what a clinical nurse specialist does. Both of them may not know what a clinical nurse leader does. The nurse who is considered an informatics specialist may have very little actual knowledge about the role or the practice domains of the nurse practitioner or the clin spec. Nurse anesthetists may sometimes feel fragmented because they are working primarily in a perioperative setting and don't have always an opportunity to engage with a variety of colleagues. People who are in staff development or professional development sometimes struggle with how to relate to somebody then who's prepared as a nurse educator but is in a nurse management position. We've got this intraprofessional issue that I think is really important. And we know that this is actually a legitimate problem because, we talk to our new to practice nurses or our nurses who are working at that sort of sharp point of care at the bedside, and we talk about these different roles or we introduce ourselves to others and they're really not quite sure what we can do. And much of the work that we do has an opportunity to be shared. And in order for us to pull the right members into our team and for us to work in the best way possible with our colleagues, we have to know what they do and we have to know what they can contribute. So one of the reasons I decided to write this text with this idea of advanced nurses is to address this intraprofessional problem that I think hinders us from a lot of really good interprofessional work. We also know that our interprofessional work, working with physician colleagues and physician's assistants and administrators and finance folks and all of these kinds of things, we've got impediments to collaboration that revolve around things like negotiation, conflict resolution, shared understanding of problems, identification of outcomes, priorities, financial concerns. All of these are impediments, and I am hoping that you will agree with me that this book does a very good job, I think, of presenting content and opportunities in a coaching style voice that helps to work through some of these intra and interprofessional impediments. We also know that our transitions to advanced roles are often not well supported, and I hear this from my students who continue to remain in touch with me. I'm sure all of you run into the same thing where, you know, particular people that you end up knowing over the years because you've educated them. And I'll tell you, we know that we've done a lot of work on our baccalaureate grads moving into practice and new to practice concerns and this kind of thing. But we also know that these are serious issues for our new nurse practitioners, for our clin specs, for other APRNs, and for people in new and novel roles that are still advanced. And these transitions are often not well supported. And we know that people make mistakes, they feel uncertain, they lack confidence, they look for support and can't find them. This is why we're seeing more and more in the literature about fellowship opportunities and ways to mentor and to precept those individuals in advanced roles who are fairly new and are trying to figure things out. And that's what this book also is intended to address. I want to also share with you, because I'm very excited about particularly a couple of these chapters, but you know, there is some immediacy to the topic. I have really struggled to find anything in books. For the most part, I will tell you, we've got some really great options in anymore available to us through the Alliance of Nurses for Healthy Environments. But environmental sustainability is absolutely key. We're seeing a lot on the political front as well about the Green Deal and, you know, these kinds of issues. But in environmental health in healthcare is absolutely one of our most pressing issues. All of our plastic and our waste, and how do we manage this, and how do we have a sustainable environment while we're still trying to make certain that we're paying attention to infection control and efficient care practices. And the literature is rich with professional organizations and environmental organizations where many times nurses have, you know, real roles to play. And, you know, it wasn't until I started to really work on this chapter and start speaking to people. I've had the opportunity to speak to groups about environmental sustainability, and people say, wow, I had no idea that all of those resources were out there. And there really are rich resources available that should be integrated into our classroom teaching. Violence, workplace violence. You know, there's a lot in the literature right now about you know, incivility as an example, and how important that is, and the impact that incivility has on work relationships and things like retention and job satisfaction. But we also know that there is a significant problem with the potential for workplace violence in our care settings. And this chapter looks at all of that, including things like, should we be thinking about shooter drills in our acute care facilities or our other facilities? Do we know what to do when domestic violence moves its way into our nursing station? Do we know how to manage this? Do we know the kinds of recent and current recommendations that are out there? How might Homeland Security help us? That's one of these things that I'm talking about when I say topic immediacy. Same thing with product management. You know, I've done some research on the way new products are integrated into our care environments, and I have to tell you that in some respects, we don't do a particularly good job integrating products. We buy products and we introduce staff to products, but then, you know, it's often the case that continued attention to that product, to getting replacement parts, to going back to see how it's affecting our staff, to look at whether or not there are opportunities to improve the continued delivery of that product, to sustain excellent and accurate education about that product. These kinds of things also need to be considered, and of course, risk and harm. These kinds of immediate topics are often inadequately addressed in our educational programs, and not because we don't recognize that they are important, but again, going back to this idea of there is so much to be done just in terms of clinical practice or in terms of the specialty practice that we are trying to convey and share with our students, that some of these other pieces get lost. And yet, when our graduates move into practice settings, they are expected to respond to these challenges. They are expected to be able to think about things like product purchasing, product evaluation, risk and harm, preventing such, liability, environmental sustainability, and resource utilization. But we may not have prepared them for these kinds of responsibilities. And frankly, the challenges that educators face, particularly in an environment where we know there is a faculty shortage, requires us to have resources that are easy to use and that make good sense for both us and for students. And I'm hoping that this book does that for you. So benefits of the handbook then, and sort of a summary kind of overview, is it's comprehensively referenced, and you'll see that the reviewers that have looked at the book have made mention of the fact that these reference lists are really robust. They are all, I can assure you, new and revised and verified. It's an inclusive book, and if any of you, maybe some of you I even know, or some of you may be aware of my professional background, but if not, I will share with you that, I have a passion for LGBTQ concerns. I am, a straight ally for this group. I participate as best I can in some of these topical areas. I want our marginalized and our disadvantaged students to feel at home in our nursing profession. And so this book is written in an inclusive voice. And I don't mean where I am pulling out terms and using them. Like as an example, one term that I avoid is something like male nurse, right? Or, pointing out people's sexual orientation or gender identity. I like to integrate all of that into case studies and exemplars. I'd like people to read these things and for that to be the background, clearly stated and understood, but seen as a normal condition, a normal situation and process, because it is normal. And so I try to make certain that I'm using inclusive terms, different types of relationships and details, etc., so that it is an inclusive book for all of our students. There are case studies and exemplars. There's a lot of tools, anything that you could think of, I hope, related to these topics that are government-based or freely available or that kinds of things, toolkits, etc. They are described. Sometimes the list of those items are included. Web links are provided, etc. And as I've already said, I did make a lot of effort to be sure that our topics in the book are fully addressed, that they're timely, and I think that they're unique. I'll be interested in your feedback if you decide to take a look at the book. Shoot me an email and let me know, because I really am interested to see if this satisfies those kind of interests for you. For graduate students, the book is interesting and it's compelling. It is written in a coaching sort of voice. If you look at feedback from the Clinical Nurse Specialist Handbook, this is something that I really worked hard to accomplish, and it was successful in that book, so I've used the same style. This book is written as though you are talking to your students or to that new nurse practitioner or to that new informatics or nursing education student. It's written in a coaching sort of voice. It is not a theory heavy book, but it is theoretical in the fact that it is consistent in its progression from topic to topic and in making the case that this content is important and relevant to what you do. As I said, there's lots of tools and access information. It has very much a how-to approach when you're talking about things like, how might I design an environmental sustainability project, or how might I construct a plan for self-care. We'll get to that a little bit more later as well, but it really is this how-to approach with a lot of exemplars that enable the student or the new to practice advanced nurse or the faculty member to apply what's being learned in the chapter to the exemplar that's being presented. For the advanced role nurse, maybe the person who is nearing graduation or has already finished, this is a primer for the kind of responsibilities that are oftentimes not fully addressed within the graduate academic world for all of the reasons that we've already talked about. You could be an advanced role nurse in a Doctor of Nursing Practice program or in an MSN program. I teach in both and am very well aware of those learner needs and of the frustrations and challenges that I and my colleagues are confronted with on a regular basis. It's a good bridge from the kind of clinical and practice expertise that we nurture in our students to the broader shared expertise that's expected when you move as an advanced preparation nurse into the work setting. And again, we'll talk a little bit more about this specifically when we highlight some of the chapters. So this bird's eye view is exactly that, sort of looking above and looking down and some of the things that might be of interest to you. So if you've not had a chance really to take a look at the book, or you've saw it and you thought, oh, let me check out the web presentation and I'll make a decision if I want to take a look at it or not. We have a number of chapters in the book. The book's length is 10 chapters, and the first one is about strategic career planning. And I really talk a lot about in this chapter about things like reflecting on your talents and your interests and making some decisions about where you might best fit based on self-appraisal. What kinds of things do you need to think about if you're considering, for example, a nurse practitioner role versus a clin spec versus an admin role or a professional development role? We talk about mindfulness, and we talk about developing a professional portfolio, publicizing your professional experiences. How do I craft a vitae? How do I craft a resume? What about certification should I be thinking about? And a lot of that kind of content, we really try to do a good job in most of our graduate and even in our DNP courses. And I think that this is a good supplement, or I should say a good foundational resource that helps inform what you probably talk about and where students can do assigned readings, and there's tools and activities about differences between portfolios and vitaes and kinds of opportunities for nursing mindfulness. For example, there are some really terrific apps, some real nice applications for electronic devices, etc., that can be very helpful. And mindfulness is gathering a lot of steam as a topic that we really need to be thinking about and coaching in our students as a strategy for self-reflection and continued professional development. The communication strategies and tips, I've had really good feedback on this particular chapter over the years from graduate students, because a lot of people find themselves just serendipitously trying to navigate, for example, electronic resources. They don't know how to set up files to be able to retrieve documents other than just throwing all of them into My Docs. When they're in charge of a committee, they may not know how to develop minutes. They might not really know how to run a committee. If they're chair, what kinds of things do they do? How do they maintain order and still encourage interprofessional or intraprofessional collaboration? What kinds of things do you have to think about related to netiquette? To maintaining that sort of professional voice when you're using things like email, etc. We talk about voicemail, computer usage tips. There's a lot of liability associated with these things too, and many times our students do not realize that our emails are reviewed, that you do not have personal control over your emails in your workplace. You need to think about these things. The other piece I think is interesting in this chapter is interviewing, because many times our students get finished with graduate programs and they move into these workplace settings where they now have to either lead or participate in professional interviewing, and they really don't know how to do it. They don't have much expertise. They're not sure what to ask. They're not sure about appraisal and what they need to be be thinking about, and also how they may bias interview processes in ways that are unintentional, but still, have potentially, adverse effects on the person who's applying. So there's a lot in this chapter about that. And the third is about performance appraisal. And this includes things like peer review, succession planning, employee evaluation. There's also some exemplars, because where I have found, and maybe you've found this as well, when nurses enter their professional practice and they've got advanced degrees, they're often, regardless of their role, tapped into to address potential problem areas that some of their colleagues or their subordinates are experiencing, like the nurse who had been doing a really terrific job, who all of a sudden or gradually has deteriorated in their performance. And how do you address that, right? The new orientee who requires additional supports. How do you document that? What do you do with this? What are the kinds of things that you need to think about related to performance appraisal, including your own self-appraisal, types of performance evaluation processes, and potential downsides and things you need to worry about. So that's all included in this executing effective performance appraisals. And this is a good example, another one of these topics where you certainly wouldn't say this is only a topic that pertains to a clin spec or a nurse practitioner or an anesthetist or an informatics specialist. This is something that all of us participate in, and rarely do we spend a lot of time in our graduate programs, including our DNP programs, talking about this. And yet we expect all of these folks to participate, and to participate as an informed expert with an advanced degree. The Healthcare Business Essentials is a pretty straightforward view of the context of nursing practice, budget process essentials, different types of budgets, categories of budget lines, etc. We also look at things like product evaluation, making decisions about products, what kinds of, there's a sort of interesting checklist table that you can use or your students can use to evaluate potential products, things like how easy it is it to steal this? How can it be tracked? What kinds of cost expenses are there related to the maintenance? How do you best introduce this product into the clinical setting? So there's a lot of good information about that as well. Workplace violence, I think I've really already talked about this in a way that's probably been helpful to you, but there's a lot of supplemental resource here as well, and a lot of opportunities for students in your classroom, as well as for new to practice nurses and those already out in the field, to really think about and critique the risk for violence in their practice setting, and how to develop policies around these kinds of concerns, is also, important and discussed. Environmentally conscientious healthcare is this chapter that we've already talked about, related to resource consumption and, how do we prioritize ecologically sound care practices? What kind of possibilities are there? All kinds of things, even to the point of how do we make certain that our dining halls and our cafeterias and our workplace are actually providing healthy food, sustainable food, local food? What are some of the things that we need to think about as providers of health in a larger perspective, even within our own institution, related to these kinds of topics? Now, what we talk about in one of our chapters, chapter 7, is about effectively educating to transform health. And this is about patient and community education, health literacy, what is sort of the snapshot picture of our nation at this point in time, educating nurses to support, practice excellence, what kinds of things can we do to make certain that we are providing good educational experiences, not only to our patients, but also, it's very common for nurses with advanced degrees to be teaching students, whether that's in clinical experiences or practicum experiences or that kind of thing. And we talk about some of that as well, a good bit about it. We talk about things, for example, like teach back method, which, is in here in the chapter with exemplars, with boxed out tools to help students learn and to support you in the kinds of things that you're trying to convey in your classroom settings. Things like plain language and Ask Me 3. There's a lot of time in exemplars and toolboxes that are shared through this, including even things like readability, formulas, and the kinds of tools that AHRQ is suggesting that we use to make certain that we have both readable documents but actionable documents when we're developing patient education materials, etc. And there's some good information in here about competence. And if you want to be, for example, let's say your student or your new to practice nurse wants to get involved in adjunct faculty teaching or looking at full-time educational experiences. There's all kinds of checklists and discussion points and things that need to be thought of and questions that you might want to ask during that interview or when considering those kind of job opportunities. Influencing outcomes is all about outcome management and measurement. And establishing outcomes is not an easy thing to do. And the kinds of outcomes that we need to be thinking about oftentimes when working with our intra and interprofessional colleagues can be really the difficult work. But determining the correct outcome measure is really important to making decisions about the quality improvement efforts that you are undertaking and whether or not the types of interventions you are applying are making the sort of difference that you want to see. So this chapter is all about that idea, outcomes measures and outcomes management to improve quality. And of course, the last chapter then is about harm recognition and responding to risk, to responding to the potential for liability. We talk about, the fact that people want to feel safe when they are receiving care through the healthcare system and what kinds of things can we do to make certain that happens. There's lots of IHI resources, Institute for Healthcare Improvement resources for building error disclosure, like how do we go about telling our patients and their families that we've made a mistake? What do we do about that? And how do we respond to legal charges like malpractice, negligence, claims of harm? And there's some really interesting things in there about, if you're being deposed, for example, or if you decide to do some work with legal nurse consulting. So I think that's a good bird's eye view of this sort of broad range of topics, but how deeply they are addressed within this handbook. It does have an intra-professional focus, as I've said, and that is you're working within a nursing network. In my experience, we oftentimes have tussles where people don't know who's responsible for what. The clin spec versus the professional development specialist, the staff education specialist, the nurse practitioner who's also teaching. How do we work within this sort of nursing network? And how do we work with each other in ways that maximize what each role brings to the table? It's not designed for one particular role, and that, I think, is really one significant difference that makes this book different from other books that you may have access to within your whichever professional domain it is that you're, with whatever professional role, you're teaching. And that is that you can use this book across disciplines or across roles, but you can also use it within your own role, whether you're teaching nurse practitioner students or, for that matter, nurse anesthesia or clin specs or these advanced role people, but also your nursing education folks who need to do a lot of work teaching ultimately their students about these topics. And in order to do that, they need to understand them themselves. It's also a good book for people who are in nursing administration programs who really want to build, that sort of depth and breadth across a broad range of topics. Some of the assets of the book, there are lots of textbooks, tables, boxes, figures, and exemplars, a lot of them. And, this particular figure is really one of my favorite because it's been around for a while and I used it in, the Clinical Nurse Specialist Handbook and got a lot of very good feedback. So I'm so pleased that the authors have given me permission to, again, include this in this book. But, basically it's this idea of trying to make certain that we appreciate just the sort of balancing act that there is around professional behavior. And the example I'll give is, you can see that one of the top circles, egalitarian yet respectful, and I talk about this in the book because this is that sort of weird dynamic where advanced nurses, as well as staff nurses, advanced nurses go up to a physician and introduce themselves, and I say, my name's Patti Zuzelo, and I'm the nurse practitioner for, or I'm the, and I'm introduced back as, well, I'm Dr. So-and-so. That sort of role differential, and how do you do that? Because it does represent a sort of power differential as well, that then later on informs our interprofessional collaborations. And so we've got this sort of professional model that's kind of difficult sometimes for a new advanced role nurse to understand and then learn to navigate around, because there's a certain respect that comes with titles, and yet we have this, kind of American, uniquely in some cases, American perspective about egalitarian relationships. So we spent some time talking about this, and some of these figures really lend themselves to nice classroom discussions. There are lots of boxes about key content. There are lots of figures, as I've said, lots of examples of free materials and where nurses can go to find and download and use these materials. And the exemplars, they're a fairly rich assortment of exemplars as well that help drive home in an anecdotal sort of way for students the key points that are being made in the book. More about the exemplars. These are some examples of them. There's, one that's about ensuring accuracy with tact, trying to provide feedback about a particular unit's group behavior, but doing so in such a way that's also tactful, and why is that important? Remote video monitoring and the use of those kinds of tools right now to protect patients from harm, which also have, some other considerations that need to be thought of. The what if syndrome, like, I'm buying a monitor, well, what if this and what if that? And before you know, you've got this whole system of technology that's far more than you needed, because you've got this idea of, well, what if, instead of being sort of focused on the kinds of decision making that needs to play out with that particular type of product purchasing decision. Horizontal violence, we see this with new nurses who often come into our practice arena, and so there's a very rich exemplar of one nurse who is horizontally bullied. And how does he influence this? What kinds of things are available? How does he handle it? Building a team around environmental action. Free will and missed opportunities is this idea. For example, we know how frustrating it is when advanced nurses are out there and they're trying to share knowledge, and we're doing that through in-services, for example, and people refuse to come, and the automatic sort of response to that is, well, we need more in-services at all different times and more, when the fact of the matter is that at some point we need to hold nurses accountable for their own free will decisions to attend or not to attend. And how do we manage all of that? And what's a healthier sort of way perhaps to influence these kinds of processes that get nurses going to what they need to go to and help us maintain a safe environment for our patients? So these are just some of the exemplars. There are, plenty of them, and as I said, they're very rich and they are inclusive as well. Some of the features, as I've mentioned, we use inclusive pronouns, we pay attention to sex, gender, stereotyping, and we avoid it. Pragmatic content, this is, it's deep and it's rich, but it is practical. This is stuff that we want our students, our advanced students, regardless of specific professional role, to understand and to be able to feel confident with. I've already mentioned to you how it's written. There's lots of tools, and again, no prioritization of roles. I will say, though, that, although there's no prioritization of roles, I make certain throughout this book that sometimes it's a nurse practitioner, sometimes it's the informaticist, sometimes it's the manager, sometimes it's the clin spec. These roles are used throughout the book. However, the use of these roles is more to make the case of our intraprofessional collegiality that is so necessary to improve outcomes and influence processes. So we may use this book for classroom discussions, post-conferences, self-directed. It's certainly rich, and there's a lot of references. So these, I use this book myself with my doctoral students. I know that there are colleagues who are using it with their master's students. And believe me, there's a lot that can also be read and discerned from the book using it as a textbook for your classes. You might find that preceptors and other leaders can use this book as a coaching tool. Some of these chapters in particular really lend themselves to this kind of thing for our new to practice nurses in advanced roles. There's no need to search for additional publications. They're very comprehensive, and each chapter is comprehensive on its own. You do not necessarily need to use this for one course and assign all 10 chapters. If the students have the book, you can use it across different courses. And, I have to say, I appreciate the variability in textbook selection because I've been doing this for a long time, as probably many of you have. And, after about 30 years of teaching, at some places, textbook decisions are very unilateral and they are by the professor teaching the course. At others, it is a process. It is a collegial process or a collaborative process. But I do think that there are, and we try to integrate books many times and get as much bang for the buck as we can because they're not inexpensive. So I think you will find that the Indirect Care Handbook can be used across a variety of courses with focus on particular parts of the book that are relevant to the particular course that's being taught. So teaching tips, again, you might want to look at project development focused on the advanced problems in the practice setting. There's a lot of discussion in this book, since it is done as a coaching sort of style, about various problems that come up in the clinical practice setting. And you can use this book then for students to jump off and consider opportunities for how they might address that particular advanced problem that they will likely be dealing with once they're out in the practice setting. There's all sorts of ideas for problem-based learning opportunities. I've done a lot of problem-based learning with advanced nursing students over the years of my practice. That can sometimes lend itself to really nice, mutually developed manuscripts that give students an opportunity not only to problem solve, but also to get published. So there's a lot of good ideas in this book and opportunities for things that people might want to think about doing to improve practice, etc. But I think they're good jump-offs for, I've done projects, problem-based learning with advanced students, looking at what do nurses really know about Medicare reimbursement, for example, or how do technologies influence our day-to-day practice environment, and how can we better understand that? And I think there's a lot of good opportunity for that in this book as well. Apply the book content to the clinical setting in which students are working, identifying problems and quality improvement opportunities, where they begin to look at their clinical practice settings in ways that are informed by this book, and hopefully perhaps in ways that are broader than just that sharp point of care, but also looking at the system within which this advanced practice is provided. There are lots of supplemental web-based materials. You could easily, for example, when doing a module about health literacy, disseminate some of these websites or have students identify different toolkits that are of interest to them, go out, look at the toolkits, and come back to the group and talk about what they've learned. The AHRQ sorts of resources, like I said, readability and actionability, there's lots in the literature about these two processes or these two structures, I should say, that are evaluated through AHRQ's PMAT tools, as an example. And you could easily do those kinds of analyses in a small group or in a classroom, or even the basis of a major, academic paper that you've got going on. And there's lots of good places for students to begin in this book. Use the resources are here that are to branch out and find other options with very little effort, given how many resources and references are available for each one of these chapters. User feedback, as you know, when you have a book, it's given to colleagues for blind review, and You also, of course, get feedback from students and from colleagues with whom you've shared the book, and it is evaluated as readable, very understandable, relevant across roles, regardless of the role of the student or the new to practice advanced nurse, and the writing style is user friendly. This is, just two examples. Preparing for a new role, I had somebody email me who said, I'd never learned anything about, as I've said, performance appraisal, and I use it now throughout. I have so many people that I need to evaluate in my role, and I never really realized how important that was going to be. And same thing, I had a nurse who wasn't performing well, and I wasn't sure what to do with it, and the book really helped me figure that out. So these are real feedback comments.
Thank you so much, Patti. That was a fantastic and very thorough presentation. So as we wrap up, I want to remind our audience that we are going to take any questions that you have live, and you can just message myself, the organizer, in the question pane. As you can see here, Patti has graciously provided her email address in case you have any further questions. So feel free to email her with anything you might have. We've also provided the link in case you're ready to request a review copy, or you can contact your account manager. This webinar, along with all this information, will be available online shortly and will be sent out to everyone in a follow-up email. So, Patti, is there anything else you would like to share as you wrap up this presentation? Perhaps you have any tips for incorporating this text into a course, or how professors use the text in the classroom?
I really think that, the way that I would incorporate the book is, in particular, think about what it is that what your current coursework has in the class specific to the role, and then identify what other types of topics you believe these students need to know in terms of as they move into practice. And then go to some of those specific chapters and use some of these resources and tools to provide breadth to the classroom content that you have. And, give them opportunities. As we've said, there's a lot going on with some of these new initiatives, whether that's violence or environmental sustainability or outcomes or things like that. Use some of these exemplars as jump-off points. Have students create their own scenarios. For example, if you're talking about self-reflection and self-care, having these new or soon to be out advanced nurses thinking about how are you going to take care of yourself, given the demands of your job, and we all know how difficult that is, and have them use some of these examples to begin thinking about those things in ways that maybe are not typically addressed within your course. I think that would be one useful way to incorporate the book into what you're currently doing.
All right, thank you so much, Patti. That was a great wrap up, and that ties in all the content together. Thanks so much for chatting with us today, and I want to wish everyone a great rest of the afternoon.
Thank you. Thank you for the opportunity.
Of course.